think that there are two big glaring mistakes or two big challenges that I see parents or caregivers with children who are on the spectrum make. The first being that there tends to be a perception that a lot of the behaviors that they're engaging in, if they're not wholly positive, for example, stimming behaviors or aggression, that the kids are in control of it and are doing it because they are being difficult or as a temper tantrum. That's of course not the case with children who are on the autism spectrum. Stimming behaviors, rigid repetitive behaviors, those are all things that they can't control and are part of the challenge that they have being on the spectrum. So the impatience that caregivers seem to have, thinking that they're doing it for attention or they're doing it because they're being difficult, that's one of the common misconceptions, because of course that then affects how they deal with the child. So that's one of the bigger challenges. The second, of course, being that whenever a child receives a diagnosis for ASD, a lot of caregivers tend to put them in a box and assume that they are cognitively delayed or that they aren't capable of reaching similar milestones as neurotypical individuals, and that also affects how they interact and the type of opportunities they give a child. So those are the two big ones that I often see. One of the things that we have to encourage in families where there is a child on the autism spectrum, we're trying to encourage a sense of acceptance. And so the best way to do that is to actually have all the children in the household be a part of activities together. Yes, there are going to be days where mom and dad might have to take the sibling who has ASD for therapy, and they might have to make certain accommodations and allowances for that particular sibling, but don't feel like you can't include the other siblings as part of it. So if you're doing a particular activity with that child, have your other children be involved so they don't feel like they're missing out on mom and dad time. If you do, for example, feel that your child who's on the autism spectrum is absorbing a lot more of parental time, then make sure that you have dedicated days for each child. So you could have, for example, a Bobby day, an Ali day, where they kind of get to choose what they like to do for the day, and the day can kind of center around them. So these are little ways that we can actually have other siblings feel like they're similarly as special. One of the things that we also try to do is to encourage a sense of normalcy. So to have the kids understand that, yes, my brother or sister might be a little bit different, but that's all that they are. We try not to kind of make it like it's a defect or a disease or an illness that the other kids need to be afraid of, and they're also made a part of the caregiving process. So those are some of the things that we can do. The first thing that you have to do is to first identify what the challenges are. No two children on the spectrum behave exactly alike, even though they have the same umbrella type of behaviors. But the key thing that's really important is to identify what those challenges are, which is why we try really hard to create an awareness of the importance of assessment. A lot of parents are afraid of bringing their kids in for a formal diagnosis because they're terrified of the label. But the whole point of an assessment or an evaluation is to help parents and therapists understand what the specific challenges of that particular child might be, and then working with that. So not pigeonholing a child based on their diagnoses, but kind of understanding what is this child's specific needs and requirements, and then going from there. I think very similar to, this is not specific to just caregivers of children who are on the spectrum. This applies to anybody who's in a caring role for any particular condition, is to ensure that you have effective outlets. So it's to ensure that you have things that you can do to decompress and to de-stress and to elicit a sense of enjoyment. It cannot be a 24/7 job, even though it might feel like it. If it isn't something that you can dedicate time to, then at least have people in your life that you can swap out to or delegate, and most importantly, to ensure that you have people that you can talk to. So one of the biggest burdens of being a caregiver is feeling very isolated and feeling like you're the only person on earth who has to go through what you're going through, and that it could not be further from the truth. So speak to the people in your life. If that's not an option, you can seek professional support, but at the end of the day, have healthy and enjoyable outlets that you can de-stress from, and also continue to keep channels of communication open when you feel overwhelmed. I think very much, again, going back to the earlier point, the stigma that used to exist with regards to autism spectrum disorder and basically any type of delay or psychological condition is the fact that these individuals are somehow deficit, or that these individuals are somehow incapable of living a healthy and happy life and require full-time support. With the types of supports that we now have available in Malaysia, kids are now reaching milestones similar to neurotypical children. And so it's about kind of encouraging the level of acceptance that it is absolutely our goal to help these kids reach their full potential, and the diagnosis doesn't mean that they have to be devoid or robbed of all of the similar opportunities. If your child is on the spectrum, there is lots of help available. It is not the end of the world. And yeah, but the main thing I'd like to tell caregivers specifically is you can only care for people when you are in a position of care yourself. So always make sure that you put yourself first, take care of you before you try to take care of another person, and everything else tends to fall into place after that.